Hello, everyone, and welcome to the Faces of Phyla, where we explore phage technology and acne. My name's Yug Varma. I'm your host. I'm the founder of Phyla and a scientist. I'm a biochemist and a microbiome researcher. And after spending a decade in academia at institutions like Johns Hopkins and UCSF, I started a startup in the microbiome space using phage technology to solve chronic bacterial diseases of the skin like acne. Today, I am delighted to be joined by Shauna Standifer. She is a licensed esthetician in the New York metropolitan area. She treats acne very often, and she's also had firsthand experience using Phyla for a while now for her acne patients. So welcome, Shauna. It is so great to have you.
Thank you. It's a pleasure to be here, and I'm honored to be on your podcast.
Oh, thank you. Thank you. It's great to have you. And I'm very excited to learn from you because as an esthetician, I'm sure you see quite a few patients with acne. I'm sure they're telling you, exactly kind of what they want and what they don't want. And so let's start there. What sort of, how much acne do you see in your daily practice and what are they saying to you?
So I see acne on a daily basis. So essentially, the clients they've been dealing with acne since they were young, and it's really hard to kind of heal their skin because they've been trying all sorts of products, from Proactive to Accutane to antibiotics, and a lot of feedback that I'm getting is they don't really want to try anything really harsh on their skin just because, it disrupts their immune system. So it's really great that you guys have a product out there to kind of target all of their needs and their lifestyle as well. So a lot of my clients have really sensitive skin, and some have cystic acne. So it's great to kind of like create a regimen just for their needs and go to a different, like a more better alternative for, I guess, sensitive skin.
And so you're seeing all these different kinds of acne, and your patients probably come and have tried a lot of things in the past, as you said, antibiotics, retinoids, benzoyl peroxide.
Yes.
And of course, benzoyl peroxide in the last year and a half, there's been a concern about it degrading into benzene. How do you counsel your clients based on that? Has that changed any?
So essentially, like, even if they're on benzoyl peroxide, it hasn't really helped their skin as much.
Mhm.
It dries their skin out more and it causes other issues with them. Whereas sometimes they break out into cystic acne. So, like, some products like antibiotics, benzoyl peroxide is too stripping for their skin. So they want to kind of um, heal their skin for in a different alternative, because they don't want to go to that route where they have to go to a much stronger approach. They kind of want to, I guess, heal their skin more simpler, and I guess not anything too like strong. They want to kind of um the product is great because, like you said, they leave the healthy bacteria on their skin, and
Mhm.
it destroys the bad bacteria. And
Right.
essentially, when they're on benzoyl peroxide, it just dries out their skin too much, whereas sometimes it creates more problems.
Yeah, and we definitely see that one of the big problems with benzoyl peroxide and even antibiotics is that there's a high rate of relapse. So, if they're on benzoyl peroxide or antibiotics, they try it, and then after a while, or maybe after their course is complete of antibiotics, the acne comes back.
It comes back much worse
Yeah.
and more cystic on their skin. Like, as far as I have clients who've tried Proactive, where
Mhm.
once they stop using that product, then they break out into more cystic acne. It's like you have to stay on that product in order to kind of have clear skin.
Mhm.
But once you stop, you break out drastically.
Yeah, and that was one of my other questions or wonderings, because what we're seeing certain results with our customers, which are great, but I always wonder about the long-term effects of treating acne with a lot of these medications. And as you said, that they face relapses. Now, and acne is a chronic condition, right? It affects you over months and years, and you have to have a medication that keeps up with that,
Yeah.
right? If you have something that's so harsh that you can only use it for a few weeks or months at a time, and then you have to stop using it because your skin gets too sensitive and too inflamed, then like you said, predictably, when you stop using it, your acne comes back, and then you're in this kind of stop, start, stop, start. And in some cases, the acne kind of tends to get deeper and deeper,
Mm.
because the bacteria kind of get more and more established and entrenched, and then it's just harder for them to um, uproot that and solve that problem, right?
Yeah.
Um, so turning to phages, right? Phages are these tiny microorganisms. They're viruses of bacteria, and they're naturally abundant on our skin. But specifically, research has shown that phages are much more abundant on healthy skin, and they're actually quite deficient or rare on acne skin. So there's this kind of natural deficiency that people with acne have of these natural phages. And really our mission in terms of like developing this product and basing this company on phage technology was to supplement the deficiency and restore this beneficial microbe on people's healthy skin so that it could recalibrate the microbiome, bring it into a balanced and healthy state. And what that does is not only does it solve your acne for the short term, but it sets you on a path for the long term, as we were talking about the need for kind of a long-term, um, very effective product that's free of side effects. This is really, some of the properties that we purposefully built into our product. So I know that you've been recommending Phyla to patients for a while now. Can you give us a sort of little bit of insight into some of the long-term benefits of using this technology or this product?
So the long-term benefits is that eventually, like, it clears out their skin where they don't have to rely on other, I guess, harsher products.
Mhm.
And it helps with the redness in their skin. It calms it down, which is one of their main concerns, is because when you do have inflamed skin, you tend to kind of notice it a lot more, and they feel more, I guess, self-conscious about it.
Mhm.
So calm the redness down, and then you kind of heal the skin from the inside out, and their skin tends to clear up more, and it lasts a longer time than, let's say, if they were to use Accutane or any other like antibiotics, harsh alternative for acne. Uh,
Mhm.
so it's great that they can kind of incorporate it in their skincare regimen and use it, I guess, in the long term effect, just because it helps really, like, you can actually see it working. The more consistent you are with it, the more better results you'll see in your skin. And if you do stop using it, there's no like breakouts or any other like effects that their skin might get if they were to take, let's say, proactive, or um, if they were to do like doxycycline or chemical peels, because it does come back. But with the product, and if they are using it consistently, you actually see the results, and you don't break out into any cystic acne like they would if they were to stop antibiotics.
Yeah, that's very true. And that's something that we've seen on our side as well. And, one of the long-term challenges with treating acne, right, is that sometimes you have someone who's not compliant. I mean, compliance obviously is the key for any product, any medication that you prescribe for anything. And what we've seen with regular compliant usage is typically you start to see results, and then as you sort of proceed with it, Phyla is also a great maintenance product because it will keep your microbiome balanced. It won't overdo it one way or another. And the idea is to kind of give this organism, the phages, a chance to what we call engraft into the microbiome, which is to kind of find a home there and grow naturally. So how, like, when do you typically see results with Phyla?
I would say usually after a month or two is when they kind of see their skin really transforming. Just because, like, since it does calm the redness down, they can kind of notice, like, I guess that's their main concern is the redness.
Mm-hmm.
And then once it comes down, like, they can notice their skin clearing up a lot faster than they would. And they're, a lot of times they're shocked by it because they're like, wow, I can't believe this actually worked for my skin. They've tried everything on the market. And, you know, sometimes it's the simpler things that kind of give your skin the best results. It gives your skin hydration as well. And they notice their skin, like the barrier of their skin is getting healthier and it's strengthening.
Amazing. Yeah. And, that correlates with our clinical results as well, where we saw within the first 2 months that we start to see the best results for most people. And it's also something where inflammatory acne is a real, I think is one of those very visible subsections of acne where our product shines because a lot of inflammation is driven by C. acnes, right? The
Yeah.
bacteria that causes acne. And, obviously we know that bacteria is not the only cause of acne. There's hormones, there's so many other components to it. But the hormones also do affect the growth of C. acnes by changing the amount of oil or sebum your skin produces. And so it's all kind of multifactorial, it's all interconnected, but C. acnes overgrowth is a big, big part of acne. And when we have inflammatory acne, like you said, applying Phyla and getting to the root cause of that without causing collateral damage or without causing a lot of side effects is really what helps people see the results. Because to me, it's kind of a little ironic that the acne is an inflammatory condition, your skin is inflamed, it needs kind of more care, right, and more gentleness. But often the products that we put on it, from retinoids to benzoyl peroxide, are quite harsh. They dry out your skin, they make it more inflamed, they make it more sensitive. And so I'm obviously people need efficacious products. They have a problem, they need to solve it. But I also do feel for them when they have to struggle with extreme dryness, extreme, like some people have said, oh, retinoids make my skin really hurt. And so, especially today, when I think the stats are that about 50% of people with sensitive skin, or 50% of people have sensitive skin or report sensitive skin, that we are living in a world where whether it's pollutants or whether it's, I don't know, microplastics or whatever the reason is, that people are seeing increased sensitivity. So can you talk a little bit about how Phyla fits into someone's regimen, in terms of the ease of it, in terms of if they have sensitive skin, and kind of what their experience has been?
Yeah. So their experience has been that they love the fact that it's very simple to use on a daily basis. It takes about maybe 10 to 15 minutes to kind of start or end their day, whereas most of the products on the market is like 5 products, which takes a longer. And then sometimes when it's a lot of products, they get tired and they're not able to complete the regimen on a daily basis. So I do have clients that have hormonal acne, or some clients that are, let's say, pregnant and they're going through hormonal acne. So the products is really, it's good for their skin. It's not too harsh. Like, let's say if they are pregnant, they can use it still because it's good for sensitive skin. So, I mean, I feel like they love the fact that it's gentle and it actually works, and the simplicity of it, where they can kind of use it on the go. If they're traveling, they can easily bring it with them, and really kind of incorporate it where, it doesn't have to feel exhausting.
Hmm. Yeah, and that's a great point because especially if you're pregnant or breastfeeding, um, a lot of anti-acne medications are not recommended, whether it's your more powerful retinoids or antibiotics or even benzoyl peroxide. Definitely, you want to consult your doctor, and the doctor may, not advise it in many cases. And the beauty about Phyla is, again, we're trying to mimic what happens on healthy skin and just kind of give you that one thing that you're deficient in. And because we are trying to recreate kind of the natural conditions for healthy skin on your skin, it is completely safe for, pregnant people, breastfeeding mothers. And it's a really great option that you have because so many people during pregnancy feel, experience that breakout, right?
Yeah.
And they're like, whoa, in many cases they're like, I never had this issue before, or I had this, I thought I left it behind. It's a little traumatizing that it's kind of come back. And in the middle of dealing with all of this, now you're like, okay, now I have to figure out what's going on with my face, and I've got to be safe, obviously, right? Because
Yeah.
now I'm literally creating life. I have a kid. I'm going to have a kid. So these are really important things, and I feel like if you can solve this one problem, which is often important because it's on your face, it's something that people are very thankful for. So it's great that we're able to provide that in that option with Phyla as well. All right, last question. We've talked about side effects, and we've talked about sort of conventional acne products versus microbiome products. I'm sure you've heard about, learned about, and kept track of microbiome technology, microbiome products in skincare. Are there a lot of microbiome products out there? Um, are there ones that you trust? And what do your patients think about, microbiome-based technologies when they are concerning skincare? Are they curious about it or not? Tell us more about that.
So they are curious about the microbe, just because, they do understand that you do need healthy bacteria on your skin, and in order to kind of really heal your skin. But I would say I haven't really seen too many on the market that actually has microbe really to help their skin. It's either you have to go the harsher route or nothing at all, like they won't see any results. So a lot of times they're curious about it because sometimes it's like the first time they're hearing about it. So we kind of have to educate them and let them know, it's always great to kind of not strip your skin. You have to have, like with everything, um in your body, you have to have some healthy cells and then bad cells, and in order to stay healthy. So they understand how it works from the inside, and then you'll see it on the outside. That's, sometimes it's something you got to work deeper in the skin in order to kind of see your skin healing in the process of it. So it's, they understand the, I guess, the scientific aspect of it, but um, to be honest, there's really nothing on the market that has that.
Yeah, and I think that the microbiome technology space is incredibly exciting. But I've been working on this technology for about 9 years now, so it's been a while for me as well. But from my point of view, that's the amount of time that it takes to do actual, research and bring science out of the lab into the clinic, into the real world. And for me, it's been a real labor of love, but I am also really passionate about and very excited about other forms of microbiome technology, uh, the kind of prebiotics, probiotics, postbiotics. And for me, it's really important that we as, technologists, as researchers and providers of microbiome science, that we are advancing legitimate technologies that's based on science. So, for example, we have a clinical study that we did a few years ago on phage technology in acne that is going to that has been accepted for publication. It's been peer reviewed, and that's really important for us because there's marketing the microbiome, and then there's actually delivering it. And we firmly believe in the latter because ultimately, if people don't see the benefit of something that is touting the microbiome, they very quickly will realize that they're just being sold a bill of goods. And that's not good for anyone, because then legitimate microbiome science gets sidelined, and then people justifiably lose faith in a technology that could ultimately be very impactful and help them. So, Shauna, thank you so much for your perspectives. This has been really, really helpful. And I'm sure everyone listening to this, watching this, will come away with some really good pearls of how to incorporate Phyla, how to recommend Phyla, and how to use Phyla to get rid of their acne and keep it away for good. So we'll talk soon, but to everyone else, thank you so much for listening, for tuning in and watching. We'll be back soon for more.
Thank
Bye.
you. Bye.
Bye, Shauna.
Bye.